groups. We're so honored tonight to have Dr. Ken Smith, diplomat of the American Academy of Dental Sleep Medicine, the American Board of Dental Sleep Medicine. Dr. Ken Smith has been treating sleep apnea patients for many, many years with oral appliances. As you all know, he's one of the top speakers in the field. And Dr. Smith and I have worked at many, many meetings together and go way back. And so I'd like to welcome Dr. Smith. Thank you so much for joining us, Ken.
It's my pleasure.
All right, so this evening's presentation is on sleep hygiene. And I can't wait to see this one because I know that, I don't know if you're going to mention cats, but I do have two cats who have not been kicked out of my bedroom. But they're older, they're pretty good most of the time. So I'm anxious to see what folks should do to make sure that the sleep is as promising as it can be. So, again, welcome, Dr. Smith, and let's go.
All right, let's get started then. Sleep hygiene, I think probably most people understand what that is, but essentially it's just what are your sleep habits? And you can have good sleep habits, you can have bad sleep habits, so that's what sleep hygiene is all about. It's just making sure that you are doing everything you can to create a good environment for sleep. Basically everything that you do during the day will affect your sleep at night, and as we know, things that go on during the night will affect your day the next day. So it's just one big continuum, and we'll kind of move through this. As we've mentioned, you can certainly ask questions either verbally or with the chat box. I'll be happy to stop whatever I'm saying and answer whatever you guys have. So let's move on. Let's see. Here we go. All right. So as you can probably imagine, times are certainly changing. We need about 7 to 8 hours of sleep every night, but we're getting much less than we were 50 to 100 years ago. Things have changed a lot. We don't necessarily carry guns to bed anymore, but we certainly do get more sleep, less sleep than we used to. In fact, we get about 38 minutes less on a weeknight than we even did 10 years ago. So this is really trending in the wrong direction. We've got to consider a lot of things, though, when we talk about sleep hygiene. And I really should back up a little bit and say that we're really talking about how we talk to patients as well, and not just ourselves. Of course, we should all have our own good sleep hygiene, but we also want to make sure that our patients do. Because if we're treating patients for sleep-disordered breathing, and I would assume at least some of you, if not most of you on this call, are already doing this, then you need to know many of these things can affect your treatment outcome. Certainly mood disorders, anxiety, and other behavioral issues that we will get into. For that reason, this is my sister. She is a psychologist. I'm lucky enough to have her close to me so that I can refer patients over to her. I deal with lifestyle interventions to a certain degree, but sometimes when it involves cognitive behavioral therapy, then I do end up referring to her. She is also, we do a radio show. I do a radio show every Tuesday. I was out there this afternoon. It's a live show, and she's on with me every other week, and she's very helpful in discussing the mind and how it either detracts or helps with sleep. Usually detracts, as we can't turn our brain off. So if you've got a patient or a relative that's a psychologist, I would encourage you to develop a relationship with them so that you can send patients to them, and then it can be a reciprocal relationship as well. Now, lifestyle interventions, as you might imagine, are absent in most of our treatment plans. I would wager to say that most dentists that work with apneic patients, we'll help them with their appliance and fit them and check the results, make sure that they're being treated properly, but we don't really get into lifestyle interventions, or LIs as we like to call them. And so a lot of this is about those kind of things, which sort of of tails into the sleep hygiene. When you hear me say LIs or sleep hygiene or even CBT therapy, then it's all the same thing, I would say. Benefits of LIs, as you can imagine, most patients would prefer to change their behaviors when they can, if they can avoid medications. Hold on here. Let me see what's going on with this. All right. I think we're good. Okay. Medications, a lot of patients like medications, but then again, you've got certainly a certain segment of the population that does not like taking medications. And in fact, most in these two studies show that they actually prefer non-invasive techniques like sleep hygiene to try to control things rather than using medications. Now, the American Academy of Sleep Medicine, their parameters do refer to behavior modifications. However, they are not required to learn this in medical school and even in sleep medicine fellowship. So if we can upskill ourselves in these, we're ahead of the game, certainly, in discussing these things with our patients. Weight loss is certainly something that we should be able to discuss with our patients. You know, it's not like they've never heard this, but 40% of obese patients have obstructive sleep apnea, so we should be discussing this with them. The studies show that if they just increase weight by 10%, then you're increasing your apnea by 33% there, and if you decrease weight by 10%, you can decrease by about a quarter. So it certainly would be beneficial to engage this discussion with our patients, make sure that they're aware how weight has to do with treating their apnea. But the problem is, who does the encouraging? I mean, do the physicians encourage? You know, I think they pretty much. I read a study where 51% of physicians are obese, so I don't know that they can speak from a healthy perspective. I think in general they don't even have enough time to counsel their patients for weight loss, so I think it's up to us. I think we should be doing this. This is typically what I see on a sleep study that comes back. There's always something in there that says weight loss to an ideal body weight is recommended, something to that effect. But I know without a doubt, because I asked my patients, did they discuss weight loss with you? And the answer is always no. So it's just part of the boilerplate that comes on these sleep studies. Again, I think we owe it to our patients to discuss these things with our patients. But if we need another reason to upskill ourselves, I don't know if anyone read in Sleep Review that just came out in January-February issue, Barry Krakow. I had an excellent article. You might go read that. But he discussed chronic insomniacs. And he says specifically for those whose sleep aids are not working. By sleep aids, we're talking about Ambien and any of the sleep aids, melatonin, all of the things that patients may be trying to use. If they're not working, then more than 90% of these have sleep-disordered breathing. And on top of that, if they end up waking up in the middle of the night, there's even more chance of them having sleep-disordered breathing. So almost 100%. So I think that's one indication that if we should be looking at patients that do have insomnia, asking questions on our health histories about insomnia, and even marketing to insomnia patients and not just to patients who snore and have sleep apnea. There is something he also refers to as complex insomnia, and this is the fact that simply having your sleep fragmented can destabilize the airway. You're more likely, if you continue to have your sleep interrupted over the years, to develop sleep-disordered breathing. And so if we can create a good sleep environment for our patients, hopefully we not only can improve their sleep-disordered breathing, but maybe those that we catch beforehand, we can prevent from developing snoring and sleep apnea issues. Believe it or not, that is what Krakow says in the magazine. I would encourage you to read that if you get that magazine. Now, some of you may be using a bed partner survey. Again, for those of you that are treating this already, what I would suggest is actually giving this survey to your patient to fill out rather than to the bed partner, or actually have each of them fill out this survey. Because what you want to find out is your patient being bothered by the bed partner? And so if you can find out if the patient's bed partner is snoring or gasping for breath, etc., it will give you an indicator as to what might be causing some fatigue issues with your own patient. Because many times we will treat a patient for sleep disordered breathing and we get a follow-up study, they're looking good. However, the patient is still fatigued. I'm sure those of you that treat this, you're very well aware of this, and it gets frustrating sometimes. So we need to get to the root cause of this. Sometimes it's simply their bed partner. So giving them a survey like this would be beneficial for some of you. I do encourage that. Now, the bed partner can be causing all kinds of problems with your patient. Obviously, they can be snoring, gasping, periodic limb movement disorder, stealing the covers.
So it says stealing covers.
Temperatures in the bedroom that we'll talk about, and what's causing the right kind of temperatures for most people. Sleep talking, cataphrenia, which is sleep groaning. Partner's pets, as Rose mentioned. Disparate bedtimes. The bed partner comes to bed at a different time than your patient. That can be a problem. The partner can have the television on. So obviously there are many reasons why a bed partner can create issues for your patient. However, studies show that actually couples that sleep together will live a healthier life and actually live longer. So we really do want our patients sleeping with their bed partners, but we need to fix whatever's going on that's creating bad sleep habits for our patients. Let's start with light. As you might imagine, light is not good during sleep. Certainly light, even in the latter part of the night, is not good. Before going to bed, it prevents melatonin release, and that's the idea behind sleep. We need to get melatonin release to help affect sleep, so we don't want anything interrupting that. And certainly any kind of light, whether it's from outside lights, from a TV, from overhead lights, from ambient light coming through the window, all kinds. I even have patients telling me that the little red dot on their VCR keeps them awake. So I think it's important to remove all light. I'm typically telling my patients to wear a sleep mask so that they can cut out 100% of the light. I didn't used to wear a sleep mask, but then I started wearing it, and I thought I had good sleep until I started wearing the sleep mask. And all of a sudden I realized my sleep is much better. So you may not even realize how much light is affecting you. If you're familiar with how this works, the pituitary gland sends a signal to the pineal gland to secrete melatonin. It's called the third eye, and it realizes when there is light coming in. And so if there continues to be light, the pineal gland won't secrete the melatonin, and it's more difficult to initiate sleep. In addition to this, bright light can also boost breast cancer. 22% increase, as a matter of fact. The problem is over 22% of women sleep with the lights on all night long. The overall statistics are about 11% of the population sleep with the lights on and the TV on, but 22% of women. So it's 11% sleep with the TV on. Sorry, that's a little confusing. 11% with the TV on, but 22% with the lights on. That's just a very high number. So we need to be counseling our patients, if they can, to turn the lights off for more than one reason. I don't know if you recognize this guy, but he slept with the lights on the last 10 years of his life and certainly had some problems with that. Light during sleep is not good.
Oh, it was Michael Jackson.
Yeah.
I was a guy at the top. I thought that was a woman.
That was Michael Jackson. Yeah, that was the woman.
No, that was Michael. Now, Ken, I found it interesting that a lot of women sleep with the lights on. Do you think, commonly, like single women sleep with the lights on or even the TV on, just to have feel safer or to have some noise in the background?
Yeah, I do think that's the reason why that happens many times. But I talk to patients all the time who are married and both bed partners are happy with the light being on. So it's not exclusive to that, but I do think you're right that many times these are females who are just doing it for safety reasons and for other reasons that we probably don't need to get into. But yeah, I would agree.
But it's something to think about when you're talking to your patients. So that's interesting.
Yeah. Now there is for those of you that do use the computer late at night, I found this great new app. It's not really an app. It's a program. It's software. You can go to justgetflux.com and download it. It's free. And as the day and the evening goes on, your screen gets a little bit darker. And so it's certainly a good thing to do because, again, you've got blue light coming from the screen on your computer as well as the TV and iPad and iPhone, and blue light prevents melatonin release. So decreasing this light over time or using some kind of an orange filter over your screens would be any kind of blue light blocker would help. A bedtime routine is important. Bedtime routines, those of you that have small children or remember having small children, you are very aware that you created a good bedtime routine for your kids. You had them take a bath, brush their teeth, read a story, and then go to bed. Something like that. So we knew how important it was for our children, but then we became adults and we forgot how important it was. So one of the most important things that I think you can do is to create a very routine bedtime, whatever it is. I mean, whether it's exercising first and then having a light snack, taking a hot shower or bath, and then getting into bed, maybe reading some in a book, and then going to sleep. Doing the same thing every night will sort of teach your body when it's time to go to sleep. And that will also help melatonin release. If you take a warm bath or a hot bath and then get into a cool bed, a cool environment in the bed, it also fools the body into thinking that it's sleepy time, and you will start to get more melatonin release. So, and then finally, you don't need to go to bed until you're sleepy. If you get into bed when you're not sleepy, then your body is creating another sort of an anchor. My sister, the psychologist, talks about anchors a lot, and she says that people's anchor in bed should only be for sleep and sex. And if you read, if you watch TV, et cetera, the anchor is different. And so your mind will be active when you're laying there in bed. All right, let's talk about exercise. The National Sleep Foundation, this was the focus this last year. There were article after article after article talking about how important exercise is in creating good sleep for our patients. And so, these are just some examples of some articles that came out as a result. How good yoga is, especially during menopause, daily morning running, etc. There's no question at all that exercise helps sleep. So we need to be encouraging our patients to get better exercise. This was a survey of 1,000 people representing a pretty good cross-section, and they reported getting better sleep when they got good exercise. Now they compared them to non-exercisers. You looked at light, moderate, and vigorous, and 76 to 82% reported fairly good or very good sleep, but for non-exercisers it was only 56%. So obviously, more exercise is going to get us better sleep. Here's another part of the poll. 51% reported better sleep on the day that they exercise, which should tell you that you should exercise just about every day. And then when you don't exercise, 24% considered sleepy, and 61% of them report rarely or never getting a good night's sleep. So non-exercisers are not going to sleep well. Exercisers are going to sleep well. Makes sense for everybody to be exercising. Now, Rose mentioned her cats. Or you've got 2 cats, right, Rose?
Yeah. cats and a 15-month-old puppy who sleeps really good and does not disturb me. I think, I mean, they're pretty good, but they cats get up in the night and roam around and then come back. So.
Yes, they do. I used to preach more against animals getting into bed, but I'll tell you, as much as I've tried to convince patients to get their animals out of their bed, I'm extremely unsuccessful at that. So I've pretty much stopped making the effort. I will tell you though that you talked about the single female and loneliness can also create a lot of waking moments. So I don't think that when we're counseling patients about this, we should always tell patients that they should be sleeping without their pets, because there are loneliness factors that create a lot of waking moments during sleep. And I'm no longer...
Oh, and that's a great point, because I noticed with my mother, she had trouble sleeping after my dad passed away. But we got her a cat, and, I mean, that just changed everything. She was sleeping much better. So, yeah, that could be negotiable about having the cats in the room.
Well,
You're
and
trying
I don't
to
know,
justify.
Dr. Michael Bruce, who is the sleep doctor, maybe the most well-known sleep doctor out there. He's in the media a lot, et cetera, and he's always talking about good sleep hygiene and everything. But in reality, he sleeps with a cat.
Yeah, isn't that funny? Yeah. But it's funny because I'm glad you mentioned that. I did notice with my mother, at first she was keeping her TV on, after, Dad wasn't there anymore, just, to have the company. And then we got her the cat, and we got the TV off, and the cat really did seem to help her sleep. So that's a very good point.
Yeah. I'm not as likely to counsel patients away from pets anymore. I've kind of learned that over the years. And,
okay.
Yeah, in fact, this was a study out of sleep a few years ago, 95 participants, and they found loneliness to be a significant predictor of sleep fragments. So I think it behooves us to be aware of that at least, and I might even counsel patients to have a pet sleep with them in certain situations if they've got a lot of sleep fragmentation and they appear to be lonely individuals. Now, technology is another problem. This happens to be my granddaughter, who we found asleep with the iPad. That's how she went to sleep. So,
oh my goodness.
Yes, technology is a problem, and it's a problem with not only adults, but with kids as well, and that's why our teenagers don't go to bed as soon as they should be these days, and certainly it's a problem. It's one reason why we go to bed 38 minutes later than we did 10 years ago. We all have technology now. Didn't used to, but it's certainly prevalent these days. And as a matter of fact, have you seen this? This is a texting mitt that they've got in Canada. So if it's too cold, you wear this mitt so that you can continue to text.
Wow.
Oh my goodness.
Yeah. Now the cell phone, they've done, MIT did a study on the cell phone back in 2008, and 2 other universities have studied this since then. And they've all shown that there is less slow-wave sleep when you use a cell phone when it's next to your bed. But not only that, but the cell phone can do more, can wake you up even if you put it on vibrate, because most of you know, and most of you probably sleep with a cell phone fairly close to you. You might use it as your alarm clock. You're waiting for somebody to text you. And if you nod off to sleep and you're still in stage 1 sleep and somebody texts you and it vibrates, you go up and you wake up and you go over there and see who texted you. Well, that's not good. So at our house, we have a cell phone garage in the kitchen, and the kids growing up, they had to put their cell phones by 10 o'clock. They had to put them in the kitchen, in the garage, plug them in, so they could be charging at night. because it did impact their sleep. And I didn't want my kids to let technology ruin their sleep. That got some argument, but it's a good thing to use if you ever decide to be a little stricter with your kids or your grandkids. Might suggest it. All right. Go ahead. What? All right.
I was just, that's a great idea because I see a lot of people sleep with their cell phones right in their bed. So.
Oh, yeah.
Well, my kids used to, so.
There's all these apps out now, too, where you're supposed to put your cell phone on your bed.
Yeah.
So, and I'm not sure I like those apps. I'd rather you wear a Fitbit or something like that than use one of these cell phone apps if you have to lay on your bed. All right, let's go to caffeine. I don't think enough people realize how much caffeine impacts their sleep. There is a good sleep app out now, or a good caffeine app, I should say, that's called Caffeine Zone 2. So if you want to know how caffeine affects you, or the last time you can have caffeine before it will interfere with your sleep, download that app, Caffeine Zone with the number 2 and an LITE. It's a pretty good app if you want to, again, just measure and know what's a good time for you to quit the caffeine. But there are study after study showing how caffeine, certainly in the late afternoon or evening, is going to disrupt your sleep. So most people have figured this out. They know how caffeine affects their sleep. So you don't have to, your body sort of figures it out. It gets a little jittery, and you go, wow, I had some coffee at 3 o'clock this afternoon. I better not have it that late anymore. I generally counsel patients not to have caffeine after noon. That's pretty much the cutoff for me with my patients, and I can't say that they all obey that, but I think that's a good habit to get into. Alcohol is another problem. Alcohol, and I'm sure most of you know this, and I hate to belabor points that you all may already know about, but for those of you that don't, alcohol might help you get to sleep, but it certainly doesn't give you the kind of restorative sleep that you need. It takes longer to metabolize it. You metabolize it differently than you metabolize other foods and drinks. And as a matter of fact, if you drink one drink, it's going to take about 2 hours to metabolize. 2 drinks about 4.5. 3 drinks about 6. And 4 drinks take about 7 hours. So it can certainly impact your ability to get a good night of sleep. I would suggest that you keep this in mind when you're having alcohol late at night, and try to leave at least, say, 3 hours or so after you've had some alcohol before you get to sleep, and then hopefully it won't affect your sleep. This is an example of a sleep study where we know that the patient had alcohol, and can you tell from the oxygen down at the bottom when the alcohol wore off? It's pretty obvious. So if you've got patients that drink alcohol too late into the night, obviously their sleep disorder breathing is going to be worse. And so it's an area where we should be counseling our patients to not have alcohol within hours of their sleep. Temperature. I've already mentioned this, but temperature needs to be a comfortable temperature for people. I think I asked these in my seminars what temperature people have their thermostat set at, and far too many have it up in the 70, 75 degree range. And it's generally thought most people do best somewhere between 60 and 68 degrees. So I'm usually trying to tell patients to lower the temperature in their house, in their bedroom specifically. And ideally they can get it below 70 and be comfortable. Now you can get it too cold, so it's just important that you have a comfortable temperature. You've got to figure out what that temperature is. And if you and your bed partner agree on 2 different temperatures, it can become a problem. So it's not always something that's easily fixed, but it's something that I would suggest that you have the discussion with your bed partner, to decide if it's something that you need to shift. Okay, so temperatures, pay attention to that. This was was a Dutch study. I think it was pretty interesting. They actually provided thermo suits on a group of people, and then they gradually lowered the temperature. It didn't affect the core temperature, but it just affected the external temperature. And they found that lower temperatures had fewer waking moments. It actually increased slow wave sleep. And it was particularly evident in the elderly and in the insomniacs. So again, let's counsel patients to lower the temperature most of the time. Another thing you need to do is stay regular, and I'm really talking about sleep times.
Okay.
Yeah. Yeah.
Brittany, how did you like that?
That was a good one.
Yeah. Sleep times. Too many of us have different bedtimes during the week than we have on the weekends, and this is difficult for many of us to do. As we get older, it's easier to do this, but certainly young adults and other age groups have a difficult time consistently going to bed at the same time. It messes with your circadian rhythm. There's something called social jet lag, and if you sleep more than an hour longer on the weekend than you do during the week, it can create weight gain and all other kind of problems. There's some good studies on social jet lag, so it's just very important to try to get to bed about the same time every night, to wake up at the same time every morning, and try not to vary it more than 1 hour. Okay, sunlight. This is another problem that most of us, in fact, on my sleep app, the Best Sleep Hygiene app, I'm looking at all of the results, and it's very evident to me that the biggest problem people have is sunlight. They don't get enough sunlight. This is a pretty impressive study, too. I don't know how many of you have lights or windows in your offices or where you spend the most time in your office. But if you do have a window that lets sunlight come through, you're going to sleep better. This is a pretty impressive study showing an increase in 46 minutes per night of sleep if you work with windows. That's significant, and that is where most of us fail. Most people do not get enough sunlight. I encourage my patients to get up in the morning and try to spend about 15 minutes in the sunlight early in the morning to reset the circadian rhythms. They need to be reset, so at about 9, 10 o'clock at night, melatonin starts being released because it's been 18 hours. It's time to go to sleep again. Smoking. That's another thing we counsel our patients about. There are many reasons to quit, but another reason that you may not be aware of is the fact that it creates problems in sleep. 11.9% have trouble falling to sleep. All the 10.6% wake up during the middle of the night, and then 9.5% wake up too early. And this compared certainly much worse than it did with non-smokers. And I think it's pretty amazing. They figured out even that with every cigarette they smoked, they decreased their sleep time by 1.2 minutes. So smoking can create a lot of problems. It certainly, if you didn't know this, smoking is a stimulant. And taking a stimulant right before you go to sleep is not a good thing. So counsel your patients to stop smoking for more than one reason. As I said, it upsets the circadian rhythm. This is another study just this last month, and it showed that it actually affects the clock gene expression rhythms in the lung. This just to put it simply, it impacts the circadian rhythms in a negative way. It screws with the circadian rhythms. And whether you're a short or long-term smoker, it can affect either habit. So let's get our patients to stop smoking.
Ken, do you think that secondhand smoke would apply here as well?
That's a good question, and it may even be a political question. Maybe I shouldn't answer that.
He's asking political questions, but I just thought of that. But smoking, of course, is not great. But if someone's around a lot of smoke, that could affect their sleep as well, I would think.
I agree. I think it could.
Yeah.
glad you brought that up.
Very cool. Yeah, I mean, not cool, but very important to think about.
Yes, it is. Another thing that I think people fail at in general is making the bedroom a nice sleep haven that is only used for sleep and sex. And unfortunately, we use it for a lot of other things. Those of you that don't do this, if there's anyone on this call that is only using it for that, I'm impressed. That's just not the norm. I think uncluttering the room, they've shown things like horizontal lines are good, getting things off the floor, putting them on shelves, getting as many things out of the room that don't have anything to do with sleep is a good thing to do. So, as this says, 71% of people have a TV in their bedroom. So the majority of people listening to this do have a TV in their bedroom. But I think it's impressive that 11% if you leave it on all night. And I just can't imagine that 1 out of 10 people do this. However, if you talk to enough patients, and if you ask patients what they do, you will find that indeed is the case, that they are leaving their TVs on at night. You ask 1 out of 10 of your patients are doing this. I've got one couple, they grew up with the TVs on in their house, at least most of the time, and they got married about a year ago, and from the time they got married, the TV has not been off. It's on 24/7. It is never turned off in their bedroom. I really can't imagine the existence like that, but that's how they live. And in fact, she put on 60 pounds in the first year they were married, and that's what brought her in to get treated, because she developed sleep apnea as a result of this. So the bedroom really should be revered as for what it's meant for, and counsel your patients for this. I do have this sleep hygiene app that Courtney was talking about. You can go to bestsleephygiene.com and download it. It's a free app. And what we do with our patients, this just came out about 3 weeks ago. And there's about 40 items that patients can rate themselves on. It gives them a score, tells them how they relate to the general population. It also has an F4 score on there, and they rate their own sleep. I'm using it to do some research and to find out a lot more about patients' sleep habits or people's sleep habits. And so I'm gathering lots of data. But you can also educate your patients really well with this app, because they can see all of these things that are impacting their sleep. So if you've got a patient who, for example, you're treating for sleep apnea, and they are not doing well, they say that, well, yeah, the snoring has stopped. My wife has said I'm not snoring anymore, but I've still got some fatigue going on. I'm not doing well. I still drag through the day. Then you can tell them, well, here's an app you can download. It's free on an Android or an iPad or an iPhone. It's not trying to sell them anything, but it's certainly a way for them to learn all of the things that could be impacting their sleep in a negative way. So feel free to look at that yourself, and the website has a lot of different research articles on it for all of these items, the things we talked about, and many more that we just don't have time to talk about in this webinar. Don't have a lot more. I thought we'd kind of cut it off there, and we can talk a little bit, answer some questions.
Great.
There is certainly, I would love for you to come out to the seminar here. That's April 4th and 5th. We're going to be in Boston, and you're going to have a good time, and you'll learn a lot more than just sleep hygiene. If you don't currently treat sleep, or even if you do and want to do more of it, hopefully I can help you out there. So would any of you like to type in any questions, or you just want to shout them out? I've got a few of you that are muted. You want me to unmute you to answer a question? You can. What do you think? I'll tell you what. I'll unmute everybody right now. And if anybody wants to ask a question.
Yeah, you can feel free to jump right on the line and ask your question. If you don't want to ask your question over the line, please feel free to use your chat box. If you look at your control options, you'll see a participants list and a chat box. If you type your question right into the chat box, we'll make sure we get it addressed from there as well. All right, so what kind of questions over there over sleep hygiene?
Yeah, I don't see anyone typing any questions. I guess I covered everything.
I think you did. You did a great job.
Dr. Smith, that was one of the best webinars I've ever seen, and I learned a lot. This is Rose, and I really did. And it's interesting when you start looking back at the habits of your family and your patients, and it just all makes a lot of sense. And again, I don't think I've ever seen such a good presentation on sleep hygiene and the benefits of looking at these things and questioning your patient. So I really appreciate it.
Yeah, I think one place you can start is with your own team and get your team sleeping well and letting them know all of the, I would encourage you to, give a little test. Maybe, get them to download the app and get them to get a score and see who rates the best, see who rates the worst. And I think you'll be impressed with the data and figuring out exactly why maybe some of your team members kind of drag through the day and don't do well, while others are very energetic and just go all day and aren't begging to go home at 3 o'clock in the afternoon. So
well, that sounds like a fun team building exercise. So I'm sure Katie will institute that at our office soon. But we definitely hope all of you who are on tonight, and we are recording this so that those of you who hear this later, that you can join us and hear Dr. Smith on the implementation of dental sleep medicine, April 4th and 5th in Boston. It'll be fun.
That's right. Maybe we can go see a Red Sox game when we're there.
We'll definitely have a great time, whatever we do.
Is that baseball season, April 4th and 5th? Have the game started by then? I think so.
You're asking the wrong person here.
Maybe someone else can type in who knows about that, yeah.
I've been to a Red Sox game before there. I try to go every time I go to a city. I like to go to a baseball game, so I'll probably
That's cool, yeah.
Yeah, I collect hats. As you can see, I need hats. And, if any of you have questions, sir, you can always reach me at info@sleepbalance.com. If you want to contact me to ask other questions about this, I'll be glad to send you any information that I can help you with, and any documentation, any documents, anything that you'd like. But hopefully we'll see you. I know that there's another webinar coming up too, Rose, right? Suresh is going to be talking. What's he talking about?
That's next week. Courtney, I'll turn that over to you.
Yeah, Dr. Charkanda has, he's deciding on his topic still. It is going to be sleep apnea related. That's his wheelhouse as well. But it's going to be March 25th at 8:30 Eastern time. So that's our next scheduled special guest. We will still be holding our regular study group session next week with Rose and I and a fun new topic in medical billing. And just so everyone knows as well, February is Heart Disease Awareness Month. So, this goes in real great with what we do for especially our sleep apnea patients and screening them to make sure that we can catch those comorbidities that are related to sleep apnea and help them get that treated. All right, so if there are no questions, last call for any questions or comments for Dr. Smith. Okay, great. Well, thank you all so much for joining us this evening. And again, thank you so much, Dr. Smith. That was a great presentation, and we appreciate you spending your time with us tonight.
Hey, it's my pleasure.
Yeah. Thank you.
Have a good night.
And thank you, everybody, for joining us. Everyone have a great evening. Okay, bye-bye.
Good night, everyone.
Bye-bye.